I hope you're all doing well, and I hope your preparation for the exam is going well so far. And I'm also, in this video, will try to make your preparation for the exam a little easier by giving you a little bit tips and tricks on how to actually tackle the exam, and most importantly, how to study in a flow that's easy to follow and easy to connect together. For example, if you were studying something from pathology, there must be something related to it in acute care, and there must be something related to it in communication as well. So I haven't changed the way I arrange the lectures or the way I arrange all the topics of the MRCS. I've also shared with everyone all the index or the syllabus for the MRCS exam, and even if you're not using my notes, if you're using anybody else's note, you should be able to follow this plan or follow this index, because this will link things with you like in a very good way. All right. So let's start. For instance, anatomy. You basically, in my opinion, you have to start by head and neck anatomy, because it's probably the most challenging part, and this is the part that you tend to forget. And then you follow that by spine anatomy, because they are closely related to each other, and then you go trunk and thorax, and then upper limb and lower limb should be studied together as well, because you're studying the same concept of muscles and nerves and blood vessels, etc. All right. In anatomy, it's not really evident what I'm trying to explain in this video. However, it's going to be very clear in pathology. I've noticed that usually all the books available in the market is arranging the topics of pathology in a quite a random way. All right. So I thought, why don't we try to make it something like general pathology, infection, inflammation, like we all used to study in medical school. So in general pathology, we'll only have those three topics: abscess, amyloidosis, and cell death and gangrene. Of course, if I do have any sort of lectures coming in the future, I'll be able to add them here. I'm going to just give you one example here of what I'm actually doing and how to link things together. So let's say if I go to an abscess, all right? So I give it a tag as this is an MRCS pathology, and this is general pathology, to be very clear, and this is of course chapter 1. I'll be able to read about abscess, and then you can think about what will be your next step, and then you can go back to your dashboard, which will be a printed issue in your case, unfortunately, because I'm unable to share this with you. And then you study amyloidosis and cell death and gangrene, etc. And then infection and inflammation, you have about 5 topics. Hematology, you have those 4 topics. Cardiovascular, you have again 4 topics. Respiratory tract pathology, you have this. And gastrointestinal tract pathology, you have this. Genitourinary, etc. Endocrine, skin and musculoskeletal, and oncology. You will find some of the oncology are actually things that was done before, but you will be able to get them together under an oncology hashtag, as we did the previous one. There is another way that we can actually do this. So if you want to, like, for example, get all the MRCS in just one go, that should be done as well. But moving to acute care, and this is the trick here. This is actually what I'm interested in. All right. So moving to acute care, you can see that we have here cardiovascular acute care, and up there we have cardiovascular pathology. Is there a way that we can link them together? So this application that I'm currently using can actually link them together, and I'm going to show you live what I would do. So if I go to data view and just try to, give me a second. So I'm going to show you live what I would normally do if I'm trying to get all the cardiovascular section in one go. So I'll copy and paste, and I'll just ask the application to give me all the topics that has the cardiovascular hashtag. And you'll find out that it got so many topics, covers cardiovascular section, whether these are from acute care or sort of communication or whatever it could be. All right. So we'll be able to cover the whole cardiovascular on just one go. But just for the purpose of your preparation and your sanity as well, I just arranged it in acute care and then pathology, and then it's all arranged in sort of cardiovascular, like that, just cardiovascular, respiratory, gastrointestinal, etc., etc. All right. Here you have trauma, which is quite a big section. So you will study all these stations together. All right. However, I believe they should be arranged in that manner. You can also control that, whether it could be ascending or descending. I think it should be ascending. So burns is the first one that you should study. And again, here, this should be ascending as well. Yeah. Pain management, this is the anesthetics, and so on and so forth. In communication, I divided into communication with patients and colleagues. And examination, you got general surgery examination, musculoskeletal, and it logically starts by shoulder, elbow, cubital tunnel, hand, etc. And even for procedures, you have the general principle, the scrubbing, the knot tying, the suturing at the beginning, and then you go into more detail like debridement, excision of nevus, abscess, and then history taken will be divided in the same manner. So you get what I mean now. So if I'm trying to study all the general surgery topics, I'll just do a hashtag general surgery topics and everything will just show up. All right. And genitourinary and others. So in my view, you should use this index in your studies. It doesn't matter which notes are you using. And you can always ask me if you want to do any kind of combination. If you want to ask me, doctor, please, I want to study in the module-based way. Are you able to get me all the topics that covers the gastrointestinal section? And I'll be able to do it for you, and I'll just email it to you if you write your email in the comments. All right. Thank you very much, and I hope you find this video helpful.